I was actually in this space 20 years ago, lots of conferences and talking about chronic care and chronic disease management and how we need to transform the healthcare system. And we finally sold the company, and I said, you know, life is too short to do another healthcare company. This stuff takes forever, and it's so hard to do. So I kind of left healthcare and went back to consumer, media, entertainment, film. And then I sort of got dragged back into healthcare by a diagnosis. So this last year, I'd lost a bunch of weight, and was not feeling well, and something was off, and I decided in December to go to my doctors and get everything under the sun tested, full body scan, every blood test they would allow me to do, colonoscopy, endoscopy, test everything. And I had a cardiologist and a gastroenterologist, and the cardiologist is like, this is a fishing expedition, maybe it's just stress. Gastroenterologist is, maybe it's just gas. And I'm like, you know, there's something going on. And then the Palisades fire happened and burned our house down and displaced us from Los Angeles. And we ended up in Palm Desert, in an area where I didn't really, we had a couple of friends, but I didn't really know that many people, and nobody knew me. And I ended up in the emergency room for abdominal pain after a big steak dinner one weekend. And thought maybe I'm obstructed or something. So I went in and I got kind of, went into the ER, nobody knows who I am, get stuff tested kind of fresh, and it's just like a few weeks later after I had everything under the sun tested. And they pieced together a whole bunch of things that hadn't been pieced together before. And it turned out I get diagnosed with a rare version of multiple myeloma, so blood cancer. And so it's like, well, I guess I'm back in the healthcare system. On the other side of I'm a filmmaker, so it's on the other side of the camera this time. So I'm in the hospital, and I'm getting biopsies and getting bone marrow biopsy, lymph node biopsies, all kinds of new tests. And I'm just thinking, like I just had everything under the sun tested, less than a month ago, or just a few weeks ago, actually. When would AI have picked this up? I've been working in AI for the last 3 years pretty intensely. And it's a super exciting time to be building anything now because you're so super empowered by the technology. Individuals can do so much more than before. So I was a big, big builder in AI, doing things in media, entertainment, education. Now I'm in the hospital, and I'm like, when would AI have found this? And so I started building things, and I have to do a little bit of an apology because the last speaker had a slide saying you're not going to be replaced by a robot, so I guess it was not too cool that I made my Dr. AI a robot. But anyways, I took all of my data from my chart from about a 1 month period. It's in the scenario that I think I have loaded here. I'm going to make sure I just have, yes, my scenario. And I have my agent. Now, what's the difference between agent, avatar, clone, all these things? Avatar is audiovisual. Agent means agency. And when you start to trust an agent to make decisions and to do things, that's what an agent is. So I'm going to show you medical agents, and I'm going to show you why they're agents in a little bit. But Haley, can you take a look at my chart? Because something's going on, and I'm trying to figure it out. Just give me some feedback here.
Steve, I'm noticing a pattern in your labs that warrants attention. Your mild anemia alongside significantly elevated ferritin, low immunoglobulins, IgA and IgM, and hypogammaglobulinemia suggest potential bone marrow or immune system dysfunction. This could explain your fatigue and weight loss. I'd recommend hematology consultation for further evaluation.
This is from the same blood tests where it's a fishing expedition, maybe you're stressed out, maybe it's gas. It's all the same data, the exact same data. And this is like, hey, you look at your bone marrow. Bone marrow, what do you mean bone marrow? What do you want me to test? What's going on here? What should I be worried about?
Steve, I understand this is concerning. Your blood patterns suggest your bone marrow may not be functioning optimally. Consider asking your doctor about a serum protein electrophoresis with immunofixation and possibly bone marrow evaluation. This could help rule out conditions affecting blood cell production and explain your symptoms. Don't panic, we're just gathering information.
So that's one agent looking into my data. And what's really interesting about AI is when you start to have multiple agents
Welcome, Dr. Amir Haddad, Oncology. How can I help you today?
looking at the same data with a different point of view, with a different bias. You've got tremendous amount of medical knowledge already embedded into the existing foundational models we have. It's been trained on PubMed, it's been trained on the medical textbooks. There's a tremendous amount of medical knowledge in there. But just because it's in there doesn't mean you can get to it, and there's a lot of different ways to get to it, and it kind of depends. If you've ever used AI, you know that it depends on how you ask the question. So the question is not like, how do you ask the question? It's like, well, how do I ask the question 1,000 different ways? So that's like 1,000 different agents. How do I have a swarm of agents with different perspectives navigate through all of this data? So I'm going to basically put some words in the oncologist's mouth and just say, well, let's talk about Steve. And they're going to go at each other.
Amir, Steve's labs show a concerning pattern. The mild anemia with high ferritin, hypergammaglobulinemia, low IgA, IgM, and weight loss suggest potential hematologic issues. His splenic cysts might be relevant. Consider bone marrow evaluation to rule out myelodysplasia or early lymphoproliferative disorder.
Haley, I agree with your concern about the hematologic pattern. The combination of anemia, elevated ferritin, and hypergammaglobulinemia is concerning. A bone marrow biopsy would be appropriate to evaluate for myelodysplastic syndrome, early lymphoma, or multiple myeloma. The splenic cysts warrant further investigation as well, possibly with spleen-specific imaging.
Amir, I agree completely.
So they can go on for a long time, and what they're going on, they're basically to AI with different points of view. And Haley is kind of trained as like, you know everything, you're like from the future. And Amir is an oncologist, so he's looking at it from an oncology point of view. But I'm going to go, now I'm going to do multiple agents, and I'm going to take my scenario here, and I'll just keep it on, I can use any one of the foundational models, and they're all trained on medicine, it turns out, not all equally well, but a year from now, it's going to be extraordinarily better than it is even today. But let's say I'm going to take, I had a cardiologist, I had an oncologist now, and gastroenterologist, hematologist, I heard that, I've had an ER doctor. So let me pick all of them, and I'm just going to say, analyze my chart, suggest the most likely diagnosis, recommend some things. So what it's doing is it's running 5 different analyses from different points of view, navigating the same knowledge base with the same data, but a different point of view, and coming up with different things. So you sort of would expect, cardiology finds cardiology stuff, oncologist finds oncology kind of stuff. But, this, maybe it's malignancy, maybe it's inflammation, maybe it's hematology, but bone marrow, do this, do that. Gastroenterologist is looking at different things, malabsorption, it's gastroenterology kind of stuff. Hematology is a different perspective, is what MGUS, these are all things I want to look at. Emergency room doctor, more general perspective, but rapid kind of diagnostic thinking. So then I have another agent who reviews all the other agents and says, well, and that's Hippocrates. So let me go and kind of like apply my own judgment. Let me take all of that. I'm the chairman of the board. I listen to everybody's point of view, and then let me put it together and let me give you my take on it. But they all end up saying that you need to look at your bone marrow, and you need to get if it says on GPT-4, but if it was on Anthropic, it would say you need to get serum-free light chains. But the point is, it's pointing me to bone marrow, and it's pointing me to tests. It's pointing me to stuff that my in real life specialist said absolutely nothing about. But it's all with the same data. Now, I'm doing this diagnostically because I'm trying to figure out what's going on. Now that I have something, I'm getting even more data. So every day it's like, well, what's going on now? Like, what do I need to think about next? And to help me figure this out. So I'd like to introduce a friend of mine, Lisa Booth. She has another case study in here. So you would tell a little bit about your situation while I set it up.
My name is Lisa, and Steve and I have been friends for decades. And I am a 10-year thriver with metastatic breast cancer. And I have the multiple recurrent type of breast cancer. It always occurs only in my liver. And over the last 10 years, I've learned a lot about systemic treatment. I've learned a lot about local treatment. I have a brilliant oncologist. I have a great team. And through my network, I figured out that I'm lucky to live in Seattle, and there's a tumor board that's there that I've been to multiple times. And about 18 months ago, after 3 years of being clear of cancer and on Enhertu, which is a relatively new chemotherapy drug, I had a single lesion recurrence. And luckily, I have a network, and I know people, and I got in right away, and I met this great team of people, and I gave Steve this whole scenario yesterday with my actual lab results, my actual diagnostic imaging, and all the stuff in my treatment protocol, and he fed it into his model, and all of a sudden we have a democratized tumor board. So you don't have to be Lisa, you don't have to live in Seattle. Anybody, when something like this, would have access to it.
Yeah, I said, tell me about your actual tumor board. You're like, who is on it? Let's just model the tumor board, and then let's see what they say. So what I have now is the precision oncology tumor board, and we've got 4 doctors. We've got the oncologist, the surgeon, the radiation oncologist, and the interventional radiologist, because that's what you said was on your board. And there could be whatever board you want to put together. And I don't want to say analyze this chart. I want to say, oops, what did I do here? I'm sorry, what happened here? My screen's... where'd my...
So wise figuring that out.
Sorry. Okay.
A lot of what happens when you live with a highly managed disease like the one that I have is I'm having to become my own expert in things, and 10 years in, I'm really good at reading charts. I also have an interventional radiologist as a neighbor, and we read our scans together. I have a friend that helped bring the first CAR T therapy through the FDA, so I have access that very, very few people have access to. So I'm always at the forefront. Like, I was in the very first clinical trial for Enhertu. I'm on my 3rd clinical trial. And I was blown away by what Steve's tumor board found for me.
So we're both kids of doctors, so we were never like afraid of doctors. So we're used to like being kids of doctors. You're used to sort of not really respecting doctors in a healthy way.
We know they wear their underpants.
But it's demystified, put it that way. So when we get something, we call doctors, we know people, we're emailing stuff, we're engaged, we're empowered, and like Lisa's going to get a tumor board. I'm going to be calling around and driving my doctors nuts because I know a lot of doctors and I know the people who like made the drugs that I'm taking. So but how do you give that empowerment to everyone? Because not everybody gets a tumor board. So here's your tumor board, Lisa, your virtual tumor board, modeled after your real ones, and they're saying, but they're giving you local therapy, continue with Enhertu, like who knows? The surgeon's probably going to say surgery. The radiation guy's going to say radiation. Sorry about this. And then then we'll have Hippocrates going to put it all together and kind of give you the here's what you should do. So how would this help you to even have any of this stuff?
Well, what it really would have helped me is that, especially on oncology, as a patient, when you're dealing with local treatment, you become your own quarterback. Because your oncologist knows systemic treatment, your interventional radiologist knows about ablation, your radiation oncologist knows about wide-scale radiation and maybe SRBT. But it's pulling it all together. And I interviewed my first oncologist retired. I've interviewed my second one, and she's phenomenal. But she has many patients in her practice, and she doesn't have time to pull this whole thing together. So it empowers me to understand things, and it can answer a lot of the questions that I have. So at lunch, we were talking about one of the big questions I had was I ended up cyberknifing my lesion, but I wanted to understand the difference between SRBT and cyberknife. And so can we ask that question?
Yeah, so we actually had a big conversation. I don't know if we have time to actually have the conversation because I want to leave some time to Daniel to weigh in.
Okay.
But like I was doing with Haley and the others, we had a big conversation about cyberknife versus all the other stuff and back and forth, back and forth.
And I actually got a better answer today than I got 18 months ago. And 18 months ago, to get the answers, I had to go visit and do an appointment at the University of Washington with the SRBT guy. I did 2 follow-up calls with my oncologist at Swedish. I ended up picking Cyberknife because I just liked him better, and I thought he was going to do a better job of getting me through the insurance rigmarole. But I used a lot of those people's valuable time that they could have been doing other things, and it helped me understand the key difference. And SRBT and Cyberknife are both radiation.
Right. So it's like what's now, what's near, what's next. I mean, actually, this stuff is like, this is all 2025. I mean, we have not released this publicly, but it's has a few more things to do to do that. But everybody I've ever shown this to says, where do I get it? How can I get it? I want it now. So we know that there's a lot of people looking for empowerment, especially when you get a diagnosis. I mean, it's, one thing about like, eat your vegetables and prevent stuff, but once you get a diagnosis, like everything becomes very, very real, very fast. And, your doctors all have 2,000 patients and they want to get home for dinner and, go out to hang out with their kids. But, every patient is an N of one. And, we're all in and we want to know everything about it. And, I'm sitting there in the chemotherapy and getting my immunotherapy and chemotherapy surrounded by a lot of people who are actually a lot older than me, and they're all talking about my chart, and they're all talking about on the phone, talking about, talking to their kids and talking about trying to empower themselves about all of the same stuff. And so what we're doing is we're putting together this kind of resource that can be at your side, that can be extremely helpful and beneficial.
And it doesn't replace my relationship with my oncologist. It empowers me to have a better conversation with my oncologist. And because she then brings different perspectives and we talk things through. So none of the AI and the agentic AI is to replace your primary care doctor or your oncologist, whoever your specialist is. It's to help the patient, meet the patient where they're at so they can better understand things, so they can have a better conversation with their caregiver.
Yeah, but it also is empowering me to drive them nuts too. And I'm sure that there are a lot of people in the room who would be nervous about this, like, okay, gosh, it was horrible when my patients came in with a stack of stuff printed out from Google. Now they're coming in after they talk to ChatGPT about everything, and it's driving me crazy. That's all happening. It's inevitable. That's already happening everywhere. I'm sure every doctor already has a story about this. The question is, how do we empower people in a healthy way? How do we help people do this right? I mean, I'm also doing things like having the AI write the appeal letter to the insurance company because the insurance company originally denies the immunotherapy. So, hey, here's the letter. Don't waste any time. Right, here's the letter. So anyway, this is very, very powerful stuff.
All right, Daniel.
Thank you. Great. Thanks.